I think with the patients, it's becoming a much more positive discussion. A lot of patients are still not aware of the developments in AML. They're not reading this data routinely as we are. So they still, when they get a new diagnosis of AML, have a huge cloud of depression over them, and they're very upset and sad, and they feel that the outcomes are very poor. Even if they go online and read the data, a lot of this is published 5-6 years ago, and people quote very poor survival rates. So I think talking to patients is becoming very important to let them know that there are not just 1, 2, 3, 4 options, and that not only that there are many options today, but that the field is moving so quickly that if we can, let's say, get an older AML, give him AZA venetoclax, we don't think it's cured. We know most of these people will relapse, but if he relapses in 2 years, by then we may have a completely dramatic new combination that is showing blockbuster activity. The immune therapies are coming in, and we're actually seeing this in some of our patients. For example, I have patients who were treated with sorafenib and induction chemotherapy, who then failed and then got midostaurin, who are now failing, and guess what? Gilteritinib just got approved. I'm treating with gilteritinib. One is failing gilteritinib. I'm treating with the quizartinib combination. So it's not just what's available today and what may cure the disease. I don't think we still have great things that we can say truly cure AML, but then CML has not been cured and people live normal lives. But if we can get people to live longer, the pace of the science is so good that there's a really good chance in a year or two something better is going to come along. And I think patients really are happy about that, things keep getting better, and the goal is to just try to stay alive, have a, as good a quality of life as possible. And that also the fact that not having to use chemotherapy, a lot of patients love that because, using a pill, using a targeted therapy is much easier to do, much less toxic, and mentally also I think patients feel much better with that approach.